swabs.
Federal health officials are now ordering all U.S. blood banks to screen for the Zika virus. The move is a major expansion of U.S. intervention to protect the blood supply from the mosquito-borne disease. The FDA says the idea behind this universal testing is to make sure safe blood is available for everyone who might need it, especially those who might need transfusions. Locally, Virginia Blood Services tells us it's following the recommendations, but a start date has not been determined. And the American Red Cross says it's already conducting blood tests in 5 southeastern states and plans to expand to 4 more in the next 2 weeks. Since Zika is carried by mosquitoes, one local company is offering free initial pest treatments for expectant mothers in the Richmond area.
They call, they say that they're pregnant, we'll allow them to try this service for free. This is just one of the options that, that can be done for mosquito control.
Health officials also say you should dump any standing water in your yard, wear long sleeves and long pants while outdoors.
We all watched as Lucas Goller went through a successful liver transplant and is now thriving. Well, now his family is starting to give back. His mom, Jessica, donated blood to help Morgan Yoni. Morgan is 21 years old and waiting for a double lung transplant. You can donate blood too at any central blood bank.
A local cancer patient and her daughter are helping others obtain blood transfusions. Donna Latsko was diagnosed with a form of leukemia earlier this year. She spent 41 days in the hospital undergoing chemotherapy, which treats the blood cancer, but it also causes another problem.
The chemotherapy kind of goes in and kills all of my white blood cells and red blood cells. So many days after that, I will go through and often get blood transfusions and these platelet transfusions.
Her daughter, 17-year-old, saw her mother struggle and wanted to do something about it. She teamed up with the Central Blood Bank to hold a blood drive next Saturday that will be from noon until 5 at Revolution Physical Therapy's Cranberry location on Rowan Road. We have more information about that and how you can make an appointment at our website, kdk.com.
The American Red Cross has issued an urgent call for blood and platelet donations right now because more people need it in the summer. Not as many people, though, are donating. So here's how you can help. The Red Cross is having a blood drive today at the Vandergrift Masonic Lodge. And that's not all. The Central Blood Bank is having 2 drives today. One is at Penn State, New Kensington, and the other is at Pittsburgh Mills. Right now, the Red Cross has less than a 5-day supply of blood on hand.
An infection that started overseas, now it's made its way to the U.S. mainland, and it spreads. A nationwide directive, all blood donors should be screened for the Zika virus. Good afternoon. This is the NBC5 News at 4:30. I'm Dick Johnson.
And I'm Michelle Relaford in for Marion Brooks. Right now at 4:30, at a time when blood banks report a critical shortage, a new rule. The FDA orders all blood banks across the U.S. must screen for the Zika virus. MC5's Emily Flores joins us with the impact this will have on donors and donation centers. Emily.
Michelle, Zika virus can cause severe brain birth defects if a pregnant woman contracts the virus. And while it only causes a mild illness in most people, it's this haunting infection that the FDA is trying to control. Today, it released a new preventative recommendation.
Zika virus is spreading and rapidly. And while there are still many mysteries about the mosquito-borne virus, precautionary measures are key, especially at places like these. Blood donation centers. The FDA releasing a new recommendation today that all blood centers across the U.S. immediately start screening the blood for Zika before offering it to hospitals in need, saying at this time the recommendation for testing the entire blood supply will help ensure that safe blood is available for all individuals who might need transfusion. Previously, the FDA had limited the Zika screening requirement to Puerto Rico and 2 Florida counties. But with the CDC reporting cases in Brazil where Zika has been transmitted through blood transfusions, the FDA's revised and rigid guidance is in effect until further notice. Betsy Sachs donates blood at LifeSource once a month and says she's grateful for the preventative efforts.
I think it's wonderful. I really do. It's such a hard virus, and I just think that everyone should get tested. And since they're not everyone can get tested, this is the way to do it.
LifeSource Donation Center in Chicago saying it's already working on implementing the vital screening, and it does not anticipate any disruption to its blood supply as a result of this request.
It's wonderful for all those ladies that would like to get pregnant, and they might be getting other people's blood. And once their blood goes in, that's it.
According to the CDC, there have been more than 8,700 locally acquired Zika cases in Puerto Rico, and so far 29 in Florida. But travel-associated cases are much more spread out across the U.S. Coming up at 6, though, we hear from a woman who was turned away from giving blood because of her recent travels and her thoughts on the new test. We have that.
Later, Noreen, thank you. Topping the news this morning, trying to keep Zika out of the nation's blood supply. The federal government has advised testing all donated blood for the virus. Newswatch 16 stopped by a blood drive in 40 Fort yesterday. It was sponsored by Candy's Place, a charity that helps cancer patients. The Geisinger Health System tells us they've been keeping an eye on Zika for months.
There is a questionnaire that they go through, and Zika, or those questions that pertain to those countries with a high risk for Zika. Those questions have been added to our questionnaire.
A blood donor specialist added that if someone has visited an area like South America where Zika has been prevalent, they ask you wait about a month before donating blood. The Food and Drug Administration said Friday it wants all donated blood screened for the Zika virus. Newswatch 16's Alan Vickers reports it's been happening for months here in our area.
Candy's Place, a charity that helps cancer patients, held the Rainbow of Hope blood drive at its center in 40 Fort. Officials say it takes more than 2,000 donations of blood every month to meet the needs of patients in our area. Donations in the summer tend to dwindle, so officials are happy the community came out to help the cause.
Summers are traditionally a very difficult time to collect blood, mainly because high schools are not in session. High schools are one of the top contributors of blood. They literally keep blood on the shelves, not only locally but nationally.
With the spread of the Zika virus, officials are taking a different approach when it comes to accepting blood donations in hopes of slowing down the virus from spreading more. Before you can donate blood, you must go through a questionnaire to see if you are even eligible to donate.
There is a questionnaire that they go through, and Zika, or those questions that pertain to those countries with a high risk for Zika. Those questions have been added to our questionnaire.
Sabrina Cooper is a blood donor specialist and says Geisinger has already been testing for people with the Zika virus for several months now. She tells Newswatch 16 people who have visited areas where Zika is prevalent and those who came in contact with Zika patients have to wait before giving blood.
If you visited an area affected by Zika, such as countries in South America, when you come back, we ask that you wait 28 days.
Newswatch 16 talked with folks in Wilkes-Barre who say they don't have a problem with turning away people who want to give blood, but have traveled to areas where the virus has hit.
Like, if you really think about it, if that's where the disease is coming from, you wouldn't want to potentially infect everyone.
We wouldn't want to spread it more and infect more people, try to keep it to like as minimal as possible.
Alan Vickers, Newswatch.
Station. Last month, the Food and Drug Administration recommended universal testing of all donated blood for Zika virus. Central Blood Bank Medical Director Daryl Triulzi says they anticipated the increased screenings and don't imagine the region will experience noticeable impact.
We're not going to lose a significant number of donors in our donor population in Pennsylvania. In fact, we probably would have lost more donors with the geographic question than we will with testing.
Triulzi expects the blood bank will meet the FDA's 12-week time frame. He says they've already ordered Zika test kits from their vendors and usually receive results the day after testing.